Hello.
Hello. Hi, Dirk. How are you?
Doing wonderfully.
Excellent. And hello to all of those who are joining us today. Thank you so much for being present. What we are going to do today is walk you through our social impact study and report. My name is Stephanie Brown. I have the pleasure of serving some so others might eat as the Executive Vice President, Chief Strategy Officer. I am joined today by Dirk Keaton, our Vice President and Customer Relationship Manager, who is also the lead researcher for this project. So Others Might Eat, also known as SOME, is an interfaith nonprofit organization located in Washington, D.C. And today we're going to talk a little bit about SOME, who we are, what we do, and walk you through our social impact study. If you have any questions, please feel free to use the chat during this presentation. We are going to answer as many questions as we can after the presentation and even during the presentation if time allows and allots. I also encourage you to visit www.some.org/social impact to get a full view of this report, to also give you more information about what we're going to talk about today. So Others Might Eat, also known as SOME, is located in Washington, D.C. Our goal is to break the cycle of poverty and homelessness for our residents in the district. We offer a full array of wraparound services that also help our residents who live in Washington, D.C., who are living or experiencing poverty. And I believe we have some slides that we're going to open up. Our services and programs offer an array of areas that help people who are living in poverty, including we have a clothing room, we have medical clinics, we have emergency housing, as well as affordable housing, senior services, we have substance use disorder programs and treatment. We have licensed and certified counselors who are also on hand to help our residents. We have a Center for Employment Training that's also located in the district, as well as mental health services. Our Chief Executive Officer, Ralph Boyd, had a vision that he wanted us to think about how we can improve our services to our organization, to our people, and to our employees. What we did was embarked on a journey to start planning a 5-year strategic plan. Our focus and our approach for our strategic plan is our whole person care model, where we are going to ensure and make sure that we are focused on the whole person as we deliver services. What do I mean by whole person care? It's the physical, behavioral, spiritual, social, financial, emotional care that we're providing to the whole person to ensure that when we are encountering and working with our clients, that we are enrapturing the whole person so that we can deliver a full array of services and that we can ensure that we are meeting the needs of our clients. As a part of our strategic plan, there was a core tenet where we set out to plan, develop, and implement a fully integrated social change impact model that's grounded in the social determinants of health. And I am pleased to say today that our lead researcher, Dirk Keaton, took that vision and worked with an institute, Measure for Change, the Urban Institute, to help us bring that vision to reality. So it gives me distinct pleasure and honor to introduce you to Dirk Keaton, our lead researcher. So, Dirk, tell us a little bit about the Urban Institute, Measure for Change, and a little bit about yourself as well.
Sure. Absolutely. Measure for Change, as you mentioned, were the people who funded this research, and we were selected to do that. And it was a partnership between the Urban Institute actually and the World Bank. And one thing that is unique about this program is it funds research projects done by people who aren't necessarily, like I could say, like full time researchers, academics. It tries to fund research projects and provides resources through partnering with Urban Institute staff. We work very closely with them on this report. to actually have people who are from nonprofits study their own nonprofit. And I sort of follow that non-traditional researcher path. I started off as the math instructor 11 years ago in one of our programs, and I've moved from there to the evaluation team with Stephanie, where I run our CRM, but also help run studies like this. Now, when we set out to do this, once we got funded to do a project, as you saw, we have this vast panoply of services, but we wanted to focus on our community resources. And this is a package of services that includes food, clothing, mail, showers, and a lot of the community resources clients are using one or more of these services. And for these, we had a really good sense of the counting numbers, how many meals we served or how many articles of clothing we distributed. But it was really hard to find a way to articulate the sustained impact of these services, how they're really moving the needle for the lives of our clients and the lives of our city, or the lives of people in our city. And so from there, we decided to address this using a methodology we like to call, or that is called, social return on investment.
That's excellent, Dirk. Thank you so much. I am super excited about this project and the path that and the journey that we started here. It's truly innovative for us, so others might eat some, and that this has never been done before. So, Dirk, tell us a little bit about what is the social return on investment and why is that important to donors, to staff, to volunteers, to the community?
Absolutely. So probably best to start off just talking about what social return on investment itself is. And so what it tries to do is it tries to get at the impact of services by assigning a cash value to them. It's a methodology that's used a lot in England and a lot of the Commonwealth countries. It's less common in the U.S. But what it does is it looks at our services, and sometimes that cash value that we're using is based on direct impact to clients. For example, the average meal in DC costs about $4.16. And so we say that our clients save an average of $4.16 by eating at our dining room. But it can also be used to measure impact of things like with society at large. For example, what's the cost of hospital admissions for hunger-related illness, or lost productivity due to hunger? And you can also use it to measure intangible things like the value of pride in one's appearance. Once you've come up with the value of each of these things, you multiply the dollar value times the amount of services delivered, and you get an estimate of our social impact that way. For example, if I deliver 2 sandwiches at $4.16 each, I've created $8.32 of social impact. Once you've done that, and you can see from the little graph, we take away the impact that cannot be attributed to us. Most of our clients, for example, use other resources as well to help make ends meet and to get the food they need to, power them through the day. And so our clients use other resources about 28% of the time. So when we're calculating the impact, we deduct 28% of it because we knew we couldn't take credit for it. And then finally, once we've calculated the impact, taken away the impact we can't take credit for because other government programs or other nonprofits are doing that work as well, then we divide that impact amount by the amount that we spent to get this ratio. And you can see that we achieve about $53 in social impact for every dollar donated to some, and a total of about $271 million in social impact across these 2 years we studied.
What a staggering number. And it was an excellent point that was brought about this research, that it's a great way for us to let our donors know how their help is assisting us by meeting the goals of our mission. Dirk, tell me the research data collection process. Tell us a little bit about that and the steps that you took to collect this data, please.
Sure. Well, I think one thing we wanted to do is we wanted to involve the emergency services team at the start. We wanted to make sure that because they have the most view into what impact they're seeing on their clients, and also just what is the most important aspects of their services. And one thing they called out is access to public benefits. One of the real unique programs we have here is we have a mailing program. Basically, we serve as the mailing address for a little over 1,000 DC residents a year. And what is really impactful about that is that very often you can't get an ID, you can't get SNAP benefits, you can't get disability benefits if you don't have a mailing address. And so while a lot of nonprofits may serve as a mailing address for some of their clients, we run a very high volume, no questions asked mailing service, which is pretty unique. And so we saw one of the big benefits we saw was during those 2 very tough years of the early pandemic, and we'll see the numbers later, it really helped people access their benefits. And we wanted to capture that. We also wanted to look at clients as economic actors. And that was something we thought was important, both from a research perspective, but also from like a justice perspective. Ultimately, all of us, whether we're some staff member or some client or a donor, we all make economic decisions. And so we wanted to look specifically at what we're doing to basically move the needle for our clients in terms of making funds available to them, making it so they would be able to spend money on things they directly needed, like food for their kids or school supplies instead of a sandwich. And we also wanted to study clients' social connections and self-esteem. And this was something where it was just really an open question that we wanted to dig into, because we always talk about some being a community. And it's very easy to see in something like our long-term affordable housing, right? You're living in the same building, you get to know each other. But the question was, what kind of community did we have in the dining room, where you think there's going to be a high level of turnover? And so that was just something where we didn't really have a strong hypothesis, but we wanted to dig in and see what the answer was. And once we reached those questions, we developed a survey. We had a lot of data on client services and our expenses, but in order to get the question of what are our clients' overall support network, and to find out that they use other programs 28% of the time, we had to go directly to the clients and talk to them. And once we did that, not only did we learn all these facts about them in terms of their spending patterns, whether they received disability benefits, whether they were both dining room and mail clients, but we also just learned a lot of really surprising facts about the clients themselves. One thing that really stood out to us that I just want to quickly bracket is that a quarter of the clients said, actually a little more than a quarter, said they would not have enough to eat every day if they didn't come to the dining room. And roughly 65% said that they wouldn't have enough to eat at least one day a week. And that is really something, because especially there are many ways to get emergency food. And so reasonable people might ask, well, how much does an individual dining room move the needle? And the answer I think we found is that for about 65% of the clients who come through the dining room, this is something that is providing needed services that drive hunger prevention. The other thing, coming back to the social aspect, we found is that about 75% of the dining room clients agreed or strongly agreed that they have friends who go to the same some programs. And that was really profound too, because if you've ever worked in a shelter or volunteered in a dining room, very often people in those situations are very guarded. And they will tend to say things like, "Oh, I don't have friends," or, "I keep to myself." And this is just sort of things you hear every day. And what really speaks to what speaks to some and what we do is that 75% of the clients, without hesitation, said, "I have friends here." And that's quite profound, because I think not only does it speak to the environment we cultivate here, but I also think it speaks powerfully to the nuisance argument that sometimes people make about dining rooms. People will say, "Oh, it can be a nexus of crime, or it can, create public disturbances or lead to them." And I think what we have seen is that with our dining room, and because of the environment we've created, we have created a place where people feel like they have a safe and a welcoming community, and especially people who don't normally live in safe and welcoming communities. And so I think that really speaks to the importance and the efficacy of these sorts of facilities. And then another thing we did in this survey is we also asked a lot of very specific questions about their economic behaviors. Like we said, we're considering our clients as economic actors, and that was actually really useful for getting at things like pride in someone's appearance. So one way to measure how proud I am in my appearance, or what it means to me, is how much am I willing to spend on it, right? And when we spoke to our clients, they said if they didn't get our hygiene kits or use our clothing, among those who did, they would spend an average of $45 a month on those services. And so what we were able to do is peg that value to and say, okay, if you said this increased pride in your appearance, then we've given you $45 worth of savings, essentially.
This is all very interesting, Dirk. And this is a great segue into my next question, which is we have the numbers, we have the findings. You spent really great time developing this survey. So what do we do with it? What does this impact mean to the community?
Well, I'd say first, just on a basic level, to our donors, to our government partners, to our volunteers, it gives them a sense of, and to our staff, of course, it gives a sense that the work we're doing has an impact, even the work that is sometimes hardest to capture. As we said earlier, this was a difficult thing to capture the value of, and we can show that it has a real impact that we can quantify. And conversely, I think it also speaks to the impact of these services in general. What this shows, and this is maybe a sort of more a less comforting picture, but that there is $271 million worth of need that is out there over those 2 years. That ultimately, if nonprofits like us were not there providing those services, that need would be much more present, than we're seeing right now in our city, where so much need already exists. So I think it really
Mhm.
speaks to the volume of need that might be invisible. I think the other thing it shows, which is it reframes our services. As we can see here, when we talk about, one of our goals, like we said, was to reframe these things in terms of economic decisions. And so what we see here is based on our food services, on our clothing services, on the toiletries we provide, and the mail services, we're putting about $750,000 of savings in people's pockets. And if we go back a slide, we can also see that between the stimulus checks, SNAP benefits, those are also known as food stamps, or Social Security benefits, we're putting about roughly, these are all clients who are both using our mail services and receive those benefits. And basically, we're helping those clients get about $450,000 in income. And so I think this also shows as a way to say that when you donate to our services or volunteer with our services, not only are you providing them a physical good, but that physical good serves to let that to ease the economic burdens on that particular client.
This is excellent. Thank you, Dirk. It also is motivational. We do this work because we want to give back and we enjoy helping and serving, but it also is wonderful to have something tangible that we can give to even employees to say this is how your impact, the work that you do in the dining room, in the clothing room, what it means to the community and what it means to our clients. Is there anything that you learned during this process, Dirk, that surprised you?
I would say, well, obviously, I think the amount of people who have the social connection certainly surprised me. Because, like we said, we went into it knowing that it was an important question to ask, but not knowing what we would find. So that was surprising. I would say the other thing that really spoke to, and I also think one sort of supports the other, but was how frequent our clients use our services. One one thing that one thing that you'll see in studies of emergency kitchens, unfortunately, there aren't a lot, is there are very high levels of turnover in
Mm.
terms of clients. You'll have a very you may have one group of clients one day, and then the next day all the faces are different. And what we saw here was that our average client was at our dining room 4.4 days out of the week. And so what that speaks to is that we have a very stable set of clients who are coming to our services. And I think that both speaks to the community that we have fostered. It has a question of it shows that people want to come back. But I think the other thing it does is it also speaks to it. How do I say? It also answers the question of how many people are really using our services day in, day out. We don't gather any information for our dining room clients. And so the question always was, well, how many unique people are there? And so what we know is there's about an average of 250 people come through a day, and we can bet with some confidence that a lot of the 250 people the previous day are going to be the same people the next day. And that helps us scale and understand our services. If somebody reaches out to 90 dining room clients or 80, we can say with some confidence they probably hit close to a third.
Thank you. Those numbers are staggering. Dirk, tell us a little bit about future and how we will take what we learned in this impact study and use it for future impact studies.
Um, there are things we're definitely looking at. I think the dental clinic is one we've been looking at for a while. Because there is some existing research and things like this. Like I said, this is something that mostly exists in Commonwealth countries. So we're somewhat limited in sort of what examples we can follow. But so I think look at the dental clinic. One thing that's happened is we've seen a real growth over the past 2 years in terms of the amount of clients coming to the dental clinic, such that we've had to hire a new dentist. I think everyone knows that dental services are very expensive, even if you're well insured and making a good wage. And so I think it tells a really powerful story. And I think telling the story of that growth would be something. I think another one we also want to look at is our housing. We have in our housing programs, we have in-building case managers who are providing more sort of general support there, in addition to some sort of more targeted things like education and case management. Education like financial literacy. They're also providing general support, and that that's not something that's been studied a lot. So there may be an opportunity to look at these sort of less studied services and get a sense of their impact, so we can make more or less a business case for them. And I think the other thing is we can operationalize this.
Mhm.
What's great is now that we know that a hygiene kit creates about $13 worth of value, then we can say with confidence to a donor, well, you created 3 hygiene kits. That was $39 of value for our clients, if they join one of our workshops and make one. But what it also does is it lets us, create sort of rolling reports where we can look how we're generating impact over the year. And that's something we're already starting to do over here.
Thank you, Dirk. Thank you for that detailed information. Greatly appreciate it. I want to remind everyone who's listening in that you can enter your questions in the chat. We're going to take a break now and pause to see if there are any questions. If you think of questions even after this presentation, you can also submit them to myself and Dirk at strategysum.org. So that again, that email address is strategy@sum.org. We'll also put that on the banner. So we'll take a quick break here to see if there's any questions in the chat. So the first question is, why should donors care about this study? And how does knowing this information make a difference in society? Two really good questions.
I would say a lot of that is going to be very similar to what I said earlier on. I think ultimately this gets at a piece of the this gets at a piece of um, the how do I say? This gets at a piece of the impact. We can say that we know there's $271 of mead they're needing, and there's more. There are many programs doing similar work in the city, and so if we want to get a sense of what the universe of need is by people conducting similar studies, I think that will enable us to collectively make that case and say, hey, we found this much here, we found this much there. I will also say, I just this also speaks to, I think, the value of our particular model. I think one thing that differentiates some from a lot of places is our wide scope of services. Where, as you can see from our thing, we have clothing, we have medical care, we have emergency housing. And so, one of the things that makes our program different from other programs and explains in part why that number is so high is because we're highly integrated. If I was, say, partnering with 3 organizations to provide services, then you might see that $271 million of collected impact, but it'd be spread across 3 orgs. Or it may well be lower because there may be slippage as things move in between the orgs. People who don't follow up on referrals, and so I know coming to some 11 years ago, having to make external, because I was an instructor before then, having to make external referrals to clients who may not follow through, being able to say, go to Jane, that's my that's my coworker, she's going to help you. That creates a high level of success, and I think it really speaks to the integration of our model is how we're able to sort of collectively generate this impact.
That's excellent. Thank you, Dirk. I'll just quickly add to that. I think it's very imperative that we're able to show a full picture to our donors. Most times people donate money, they'll get a report on how the money was spent, but that third critical piece of how it impacted the client, how it impacted the community, how it impacted the people that it was intended to help is not always shared. So I think for me, that is one of the blessings of this report is now we can share that. And as researchers, as we go through a project and as we learn what we're doing, how we collect it, why we collect it, we're getting better and gaining those lessons that we learn as we go through this project that we'll be able to take over to the dental clinic and operationalize it and make it even better, even stronger. So I'm super excited about the future. I don't see, I'll ask our host if there's any other questions in the chat. We do have some time. Again, you can contact us at strategy@sum.org, and you can find the full report at sum.org/social impact. I don't see any other questions at this time. For those of you who joined us virtually, I thank you very much. Even if you have 5 minutes, please go to sum.org to learn more about our services. And you can give your time, you can volunteer using your time and talents. You can fund many of our programs. You can find information on sum.org to do that as well. And if you want to join our workforce, we are looking for good people who are dedicated to the mission. You can also find information there at sum.org. Again, I am Stephanie Brown. I have the pleasure of serving SUM in our CQI and IT teams as the Chief Strategy Officer. Dirk, thank you so much. Dirk is our Vice President of Customer Relationship Management. He also leads our Salesforce efforts of documenting and collecting data for all our programs. I thank you, Dirk, for leading us through this project, and happy 11th year anniversary to you.
Well, thanks so much. I'm very happy to be here.
And to our host, who you cannot see, Ebony, who has just been a jewel in our marketing department, Ebony Schamberger, thank you so much. I'm applauding you for pulling this all together and getting us here today. The innovative work that you're doing along with our marketing team is greatly to be praised. So thank you so much. Everyone, happy holidays. Thank you for your time. Have a great day.
Absolutely. Have a wonderful day.